Okay, mamas, today we're talking all things lip and tongue tie diagnosis. So what I first want to tell you is don't be discouraged if you've only seen one provider and they've already told you that your baby doesn't have a lip or tongue tie. We have to be sure that we are seeing the right person who is qualified to make this diagnosis. So if you were seen by your pediatrician or maybe just by a quick lactation consultant in the hospital and they did not do a full functional assessment of your baby's mouth and told you that they're okay and they do not have a lip or tongue tie, but you are still having problems, I encourage you to get another evaluation. It is all about the function of the tongue. It is not about how the tongue looks. So if you are struggling with nursing or bottle feeding and your baby's still struggling and you were diagnosed with just a look and not a full assessment, I encourage you to get a second opinion on that. Because most of the time, one of the most common tongue ties that are missed is called a posterior tongue tie. And those happen in the back of the tongue. And so a lot of times they'll just lift the tongue up and they'll see the frenulum and they'll be like, okay, they're tied, or no, they're not tied. And so we need to do a full assessment, check the back of the tongue, check the suck, check how it lifts to the roof of the mouth. And if that's not done with a full proper evaluation, that posterior tongue tie is missed. A lot of times you're told, oh yeah, your baby has a lip tie, but the tongue is actually not tied. In my experience, they pretty much go hand in hand. If we've got a lip tie, we've got a tongue tie. Now, maybe they're not both causing a lot of issues. Maybe one is more than the other, but a lot of times they go hand in hand and we pretty much need to do work on both the lip and the tongue. So just because they say one is tied, let's make sure the other one's not tied also, especially if you're still having trouble. If you're doing good and your baby is nursing well and there's no issues with your milk supply, then we're good. But if you're still having trouble, trust your mom gut and let's check again and see what's going on with baby. So we just really want to make sure that you are being cared for and you are being diagnosed correctly. And a lot of this is all about making sure that that tongue functions properly. Because if we're getting issues as such as mom's having mastitis, mom's having clogged ducts, baby is a messy eater, baby is clicking a lot, baby's falling asleep at the breast. These are all symptoms that something else is going on. And I want you to know that keep pursuing answers, because moms come to me and they've seen multiple people. Some of these moms get to me and they've seen 4 and 5 different people and they still know something's wrong. And especially if it's not your first child, if you've nursed before, you know kind of what that's like. That second child, you know something's wrong. Make sure there's somebody who is properly trained to assess this lip and tongue tie and make the correct diagnosis and check the function of that mouth to make sure that this is the right move. Because if we are going to do a revision, there's a process. We need to do a lot of body work on these babies because the tongue attaches to the fascia all the way down to the toes. And so a lot of these babies have symptoms such as colic and reflux because they are so tight. They are just so upset all the time. They're full of gas because they have improper sucks and they're taking in a lot of air, which is causing air in their belly. So, before we get your baby on a bunch of medications and you stop nursing, I encourage you to seek out either us or we can give you resources for great lactation consultants that can help you diagnose this properly and get your baby back on track, because we can help them and there's a lot we can do. And I just want you to trust your mom gut and know that there are answers out there.